Namaskar, friends. We will study these six stages of lifestyle disorders progression, how they happen. After, first standard only, you can go to second standard. Similarly, like that, what happens when? We will just study that today. See, 90% of population are insulin resistance of various degrees. What is insulin resistance? They have sugar levels may be okay, but insulin levels are high. With the result, insulin resistance is the calculation. Fasting glucose multiplied by fasting insulin divided by 405. The value is below 1.5. That shows health and longevity. Above 1.5 is, first of all, 1.5 to 3 is called mild insulin resistance. So that means what? Fasting glucose levels will be below 99. HbA1c is below 5.6, which are absolutely good markers. But fasting insulin level is above 7. Could be above 7, it could be 10, 15, 20, we don't. With the result, insulin resistance is above 1.5. Why I am saying 90% population are insulin resistance? What happens if somebody is having insulin resistance? What are the stages of problem? Number one, they will feel hungry. If they eat food, maybe after 2 3 hours again they feel hungry. Frequent hunger is one indication. Second is fatty liver. Nowadays most of the people are fatty liver is not a visible problem. Unless you do some ultra scan, you will not know. And also there are a lot of grades are there, so we will not get into that. Belly fat, that is a very clear visible thing. Anybody had a belly fat, that means they are having insulin resistance. Overweight, whatever weight they should be as per the height. If anybody is overweight, it is 5 feet 6 inches person should be around 60 to 65 kg. 6 feet should be around 75 kg. So anybody is overweight, you know very well. Obesity means the weight is very high. Cardiovascular diseases. See, people have lots of high triglycerides, high LDL, total cholesterol high, low HDL, high VLDL. All these are causes of cardiovascular diseases. See, lot of people, they have already have a problem of they've gone for a stent also. PCOS is a very common problem for women. They don't get the periods in time. Thyroid problem, hypertension. The BP at times will be above 120 by 80. But when they check, the sugars are normal. Why I say if sugar will be below 99? Look at stage 1, insulin resistance mild is about below above 1.5. Fasting glucose is below 99. HbA1c is below 5.6%. Fasting insulin is above 7. Unfortunately, we don't check fasting insulin. If you check also, the range they mentioned in the lab is 3 to 25. When you say above 7, you feel it is not an issue, but it is an issue. Now let's look at what is stage 2. Stage 2 is above 3. Again, look at fasting glucose is below 99. Maybe at times you find 80 also. HbA1c below 5.6. It could be 5.2, 5.1 also. But fasting insulin has increased. Now, what is the stage 3? Severe insulin resistance. That means above 5. Fasting glucose is again below 99. HbA1c is below 5.6%. But fasting insulin is high. Even if you see in the lab range, it is 21 means okay, they feel it is normal. This means what, friend? We are already in a flooding water, stuck until waist deep water. When you're a waist deep water, you should take care of your safety. Now, but all these cases we have seen, sugar is normal. But they may have blood pressure, they may have a thyroid problem, PCOS problem, cardiovascular problem. Visibly they are obese, visibly they are overweight, and they have belly fat. And also the habit, the frequent heating will be happening. Now, what is stage 4? Stage 4 is pre-diabetes, friends. See, at times the insulin resistance is above 5. It is not necessary, it should have only after 5 it happens. Pre-diabetes can happen. What is the stages of pre-diabetes? The sugar level have gone up to 125, below 125. It could be in some cases I have seen pre-diabetes, fasting sugar could be 80. But HbA1c will be definitely above 5.7%. Don't be fooled by fasting glucose. As we see sometimes fasting glucose, only people check and they're satisfied with that. This is one wrong indication. Fasting sugar is below 125. Fasting insulin is above 21. A1C is between 5.7% to 6.4%. This is a stage that your already water has come up to your chest. This is the time for alarm bells to be ringing, and we should change lifestyle, our lifestyle. What is stage 5? Look at these parameters. As I explained to you, pre-diabetes 5.7% to 6.4%, and above 6.5% is diabetes. What is the stage 5? Insulin resistance and diabetes, both are there. The above 5 is the insulin resistance. Now their sugars are above 126. See, those days have gone below 120, above 126. It is not necessary at times, it could be less also depending on what you ate in the previous night. Fasting insulin is also about 21. A1C is above 6.5%. It's a very clear indicator. HbA1c is 6.5. This means what? We are already, the water is up to our neck deep. Neck deep water shows alarming situation. Now, some people say I have no, some people may not have any indication. Look, what are the symptoms of diabetes? Increased thrust, slow healing of cuts and heals, cuts and sores, fatigue, you are getting tired, blurred vision, frequent urination, unexplained weight loss. See, this is the stage. Until stage 4, people are putting on weight. When really the sugar diabetes happens, their the cells will be starving with the glucose, and people will lose weight. This is an area where you have got neck deep water. What is stage 6? This is a stage 6. Of course, between 5 and 6, there are many years it may take. You may be at 5.1, 5.2, something like it. Severe diabetes means what? Fasting glucose is about 200. Now is the problem, friend. Your pancreas is not producing sufficient insulin. It has already worn out for many, many years. Like as I said, it may take 10 years, 15 years to get this stage. Now, when you are on diabetes, when you are on medication, when you are on the advice of doctors for eating 5 to 6 times in a day, and then you are eating idlis and high carb foods, there is no way you can get out of the problem. Stage 6 is a severe diabetes where fasting glucose is very, very high, about 200. But fasting is their pancreas is not producing insulin. So, from type 2 diabetes, you require external insulin. That is type 1. So that means your pancreas is gone, you are becoming a type 1 diabetes. But it happens very rarely, friend. Human body is so wonderful. Up to stage 5, you can reverse your things. So I hope you understand the stages. See, somebody says that, look, this guy got reversed his diabetes. See, it all depends. What is the duration of diabetes? What age he is? Suppose a person is old enough and he was having diabetes for many years and he is taking a lot of medication. That means he has already come to after stage 5, between stage 5 and 6. So it's necessary for all of us to become alert. Now people are saying you will check your blood sugars after 30. No, friends. Even you visible indication of overweight, belly fat, even at 16 years also people should get the blood test done. You must get blood fasting sugar, fasting insulin, and HbA1c, these three tests. With that you will know what stage you are in. If you are at up to stage 4, even up to stage 5, with a with lifestyle modifications, you can reverse your diabetes. I hope I've clarified on the stages, and you take action. Thank you very much for listening, friend. My name is Gangeshwar Rao. If anybody is interested, they can join my Wellness Secrets group, and you have to invest time to enhance your knowledge. Knowledge and discipline are the gateways to health, friends. Thank you very much for listening.